and thank you for joining us for this week's Community Leader Town Hall. My name is Tomas Talamonte, Deputy Chief of Staff to Mayor Muriel Bowser, and we want to thank you so much for joining us for this week's call. Today we'll be joined by Dr. Ankur Shah from DC Health, who will answer all of your questions related to vaccines and the vaccination process in Washington, D.C. We want to remind you all that Dr. Shah will provide a few more updates on the vaccine process, but we do want to remind everyone you can go online now at any day or time to pre-register today for your vaccination appointment. We want to especially urge those that are eligible to go online now to pre-register for your vaccination appointment. You can do that at Mayor.dc.gov, or you can do that by calling the Monday through Friday, 8 a.m. to 7 p.m., and Saturday and Sunday, 8 a.m. to 4 p.m., the hotline at 1-855-363-0333. Again, that number is 1-855-363-0333. Again, we want to urge everyone to pre-register for your vaccination appointment, and we also want to make sure that you go online to do that at vaccinate.dc.gov. Also, this week, Mayor Bowser announced that she will be extending the public health emergency until May 20th, 2021. There's also an announcement related to some activities that are coming online. Beginning on March 22nd, outdoor gatherings, the outdoor limit will increase to 50 people. And we still want to make sure that people are following social distancing and other guidance that has been communicated out by DC Health and CDC. So please make sure that you're doing that. Also, again, on March 22nd, some high school and middle school sports will be activated. As of March 15th, some high school sports had resumed under DC SAA guidelines. Field permits will also be issued for spring seasons, so just be on the lookout for that. As well as for fitness centers, I know we've gotten a lot of questions about indoor group fitness on past calls. Beginning on March 22nd, indoor group fitness classes can resume, so that means indoor group fitness studios can open for classes of up to 10 people, and also outdoor group fitness will now increase to up to 50 people per outdoor group fitness classes. We do want to make sure, though, that gyms are still adhering to the 25% capacity or up to 250 people, whichever is lower, the social distancing, as well as mask wearing in those facilities when indoors. So those are just a few updates on some of the changes. Finally, restaurants will be able to, alcohol will be able to be sold at restaurants until midnight beginning March 22nd. The indoor dining capacity of 25% or up to 250 still remains. So more information around those changes is available. There's some additional announcements related to what can come online on March 22nd. That's all available at coronavirus.dc.gov. So just want to remind everyone about a few of those highlights. And we're going to go now to Dr. Shah, but before we do, I just want to remind everyone, at any time, if you have any questions for Dr. Shah, you can press 0 on your phone to be entered into the question queue. Today, Dr. Shah is going to focus mostly on vaccination, but we can answer any other questions related to the coronavirus response. But again, you can ask your questions by pressing 0 now if you're joining us by phone. If you are watching on any of our live streams, whether Twitter or Facebook, you can also ask your questions directly there. We'll get to some of those questions as well. So to go through our vaccine update, I'm going to pass it over to Dr. Shah.
Thank you, and good evening, everyone. I want to start by talking about the fact that we have 3 safe and effective vaccines that are available for district residents. My recommendation is get whichever vaccine is available to you. There is the Johnson & Johnson vaccine, which is a single-dose shot, and then there's the Moderna and Pfizer vaccines, which are 2-dose shots. The ways that you could get the vaccine is through your healthcare provider. So a lot of physicians' offices, provider groups are already reaching out to their patients to bring them in to get scheduled for an appointment to get vaccinated. So that you might be on that list as well. Another way you could get a vaccine is we have these special initiatives such as our Faith in Vaccine initiative at churches or at housing properties as well. or you might have a senior buddy knock on your door to help you schedule an appointment. And then the other way to schedule an appointment is to pre-register, and that's at vaccinate.dc.gov. So if you are eligible, and specifically if you are a senior or you know a senior who hasn't gotten vaccinated, please get them pre-registered on vaccinate.dc.gov. We reach out over email, phone, or text message. You can also call in to pre-register as well. And especially those seniors, if you know seniors who live in wards 7, 8, 5, and even 4, help them pre-register. Last week, we had appointments allocated for those seniors in those priority zip codes that weren't fully filled. So we really want those folks to get registered. Additionally, if you're a district resident who has an eligible medical condition, or if you are an essential worker, specifically this week is Phase 1C Tier 1, which is those that work in food service, local government, in the District of Columbia government, public utilities, non-governmental health, human social services agencies, and working in commercial and residential property maintenance, as well as those working in environmental services. All of those individuals who are working in person. Additionally, you have those who are part of the U.S. Post Service, food packaging distribution, manufacturing, working in public transit, in outreach programs, or those working in courts or providing in-person legal services as well. If you're doing any of that in the district, please pre-register. And then hopefully, as we get more vaccine and more appointments out, you'll get your turn. It could take days, weeks, or months, depending on how large this list is as well. So that's all I just want to say at this time. I'm happy to answer your questions. Thank you.
Thank you, Dr. Shah. I know we have a lot of questions coming in, which is exciting, but I do want to remind everyone that you must press 0 now to be entered into the question queue if you would like to ask your questions of Dr. Shah. You can also ask your questions on Twitter or Facebook. We'll get to some of those questions as well. I know that we'll take a question from online from Jess Belford asking if yoga studios can open. So again, indoor group fitness can resume for classes of up to 10. Gyms also must adhere to social distancing, mask wearing, and other guidelines that are in the DC Health guidance. And so want to make sure that there will be updates to the gym and fitness, and that date that indoor group fitness of classes up to 10 can resume will be March 22nd. We will have updated DC Health guidance for gyms and fitness studios posted in the coming days. So we just ask for fitness and gym owners to go and familiarize yourself with those guidances. I don't know, Dr. Shah, if you have anything else to add on that point.
Nope, nothing to add on for me.
Great. Our next question is going to come from David Kessler in Ward 2. David, your line is unmuted.
Hi. Thank you for taking my question, and thank you for being here today, giving us this information. So I live in Ward 2. I have a pre-existing condition. I have asthma, and I wanted to know what the time frame would be for me getting this vaccine. And I know there are people who are older who are ahead of me in the line, and I'm glad that they're getting the first chance at this. However, in terms of trying to plan out my year in terms of my work and travel, and also just for my own health and well-being, I'm not sure when I'm going to be able to get this vaccine or how this is going to work. Am I going to be waiting months, or is it something that most likely everyone who registered will have it within a specific time period? And if so, what would be that time period? Does that make sense?
Yes, it does. So I want to thank you for your question and for saying yes to the vaccine. I think that's an important first step as well. You're right that through the portal, we're trying to have about 40% of it focused on seniors, but then the other 40% is really for those with eligible medical conditions such as asthma. So I can't give you a specific time frame about when you would be having an invitation. However, I do not expect you having to wait months for those required medical conditions. The reason why I say that is because we are seeing increased amount of supply of vaccine coming into the district through different federal partnerships as well as through the state as well. And and as more vaccine comes, we open up more appointments, have more provider sites as well. So we're hoping that we were really able to meet the demand of those in the district who have certain of these eligible medical conditions and want the vaccine. So I'm sorry I can't give you a specific time for yourself. It could be, this week, or it could be a little further down. It really depends on the supply of vaccine, but we're focused on making sure that you and other folks that have medical conditions have access to the vaccine as soon as possible. We did say overall we expect to be on May 1st, open up eligibility to the general public, and that's based on thoughts around how much vaccine we're going to go through and how much supply we're going to have as well.
Thank you, Dr. Shaw. The next question we have is from Ellie. Ellie, your line is unmuted.
Dr. Shaw, I have a quick question. I am getting the second Moderna vaccine next week, and can you explain what the second Moderna side effects are?
For sure. So in general, for either the first or second dose, for the Moderna as well as the Pfizer vaccine, the most common feelings you get after the dose is going to be soreness in the arm, possible fever, or body aches, or just kind of feeling a little run down. Yes. And that is, you're right, it's most likely after the second dose as well for Moderna. So especially if you've had that, if you didn't feel quite well after the first dose, it's likely that might happen again after the second dose. But no worries, it only lasts possibly a day or two, and then you can be back on your feet as well. And it might not happen at all as well.
Thank you, Dr. Shaw. Again, just want to remind everyone, for your questions, you can press 0 now for joining us by phone, or ask directly on Facebook or Twitter if you're watching one of those live streams. We will get to some of those questions again here in a second. We're going to go next to Matthew Rose in Ward 1. Matthew, your line is unmuted.
Hi, this is Matthew Rose. I'm just curious. It seems from the New York Times reporting that we seem to be in kind of the bottom sect of the country for allocations, and I'm wondering kind of what's the rate limiting step, and have we thought about when we're going to start offering vaccinations through primary care providers as a way of potentially giving more access points for people to access the vaccine?
Thanks for the question. So that reporting from those national organizations uses data that's from the CDC, and actually what it counts is doses that are delivered within our geography of the District of Columbia. So there's direct federal allocation to the Department of Defense, to the VA, to a lot of other different federal jurisdiction entities that the state, as the state health department, we have no control over. So we don't know how many doses are getting delivered or administered. What we do know is how many doses that we have and what we can put out into the community and get administered. And for example, for first doses that we receive, we're having an efficiency of over 80 to 85%. The District of Columbia is just so unique with those federal entities getting vaccinated that metric on the national scale is skewed. It's an incredible frustration because everyone looks at those as well, and I understand that, but it's not an accurate representation of what we have at the state level and what we are able to distribute as well. In terms of primary care providers, we actually have vaccines going directly to our largest healthcare providers, those that support mainly our Medicaid population, so the large health systems plus the federally qualified health centers. And now we're integrating more and more private practices as well. So you'll continue to see that grow over this next month as well. So more and more doctors' offices will have vaccine for their patients.
Thank you, Dr. Shaw. We're going to go to our next question from Minette Blandon in Ward 5. Your line is unmuted.
Hi, thank you very much. I want to know if we have any mobile units going into communities for distribution of the vaccine.
Yes, we do. We have a lot of special initiatives, so specifically with mobile or going to the community for vaccine. We partner with, for example, Johns Hopkins and Sibley Hospital, who is having on-site vaccinations at D.C. Housing Authority properties. We have our Faith in Vaccine Initiative, which is a mobile clinic through Mary Center and 5 Medicine directly at houses of worship through the Leadership Council of Healthy Communities. And then we have working with our healthcare providers that have mobile clinics, such as United Medical Center, GW, MFA, MedStar, as well, and then Howard as well. All are utilizing their mobile vaccination clinics to serve certain communities as well.
Thank you, Dr. Shaw. Before we go to the next question, I do want to remind everyone, again, you can press 0 now to be entered into the question queue. And we have time for a few more questions, so I want to make sure you get into the queue now. We're going to go next to Steve. And Steve, your line is unmuted.
Thank you. Dr. Shaw, I wanted to ask you, first of all, about the priority zip codes. Why isn't the list still on the portal, and have they remained the same, or have they been added to or reduced? And are you ever at some point planning to change targeting down to smaller, more refined clusters, such as community health areas or census tracts? And could I also ask you, is DC Health tracking no-shows and cancellations on vaccine appointments?
Thank you for the question. The priority zip codes are the same, and we can work with our team to make sure it's visualized as well. And you're absolutely right that priority zip codes are a blunt tool to really target geographic or neighborhood levels. We are working with our technology partner to see how we could break that zip code up into a smaller geographic unit. I don't think we'll get to a point where we could say ANCs or census tract, but what we could do is something a smaller geographic area within the zip code that we're targeting. So if you think about, for example, zip code 2002 and 20003, those are 2 zip codes that you have areas in which there's low coverage and harder hit by the pandemic, and areas in which there's higher immunization coverage and not so bad hit by the pandemic as well. And that's an opportunity where we want to localize that. I would expect maybe in the next coming weeks, we're able to do that with our technology partner on the portal. But also we're doing these mobile clinics, these special initiatives targeting at some of those neighborhoods. And yes, we do monitor no-show rates through appointments made through the portal. And they do vary by location. And as we're getting that information, it can adjust our strategy in terms of how many appointment slots to book as well, and then making sure there's enough vaccine on site. If some place that has historically a 10% no-show rate, there's a 100% no-show, there's a 100% show rate, we still want to make sure there's enough vaccine to accommodate those folks. So those are a couple things we're doing on the operational end.
Thank you, Dr. Shaw. And I do want to just emphasize again, so one of the special programs that's targeted at those high priority areas is the Senior Vaccine Buddies program. We're proud to share that we've registered over 740 seniors in Ward 7 and 8 for vaccine appointments, which is very exciting. The program is where we have our outreach staff going door to door across Ward 7 and Ward 8 to talk to seniors, not only to get them registered for the vaccine, their vaccine appointment, but also share just general information with them about the vaccines, answer their questions, and then help connect them to an appointment. And we've had a lot of seniors that also then connect us to their spouses or other seniors that they know to get registered. So that Senior Vaccine Buddy program will be continuing If you live in Ward 7 and 8 and a buddy comes to your door, we hope that you'll answer the door and we can get you registered for an appointment. So we're really proud of that program, and we'll continue to be out in Ward 7 and Ward 8 getting seniors connected to appointments. So we are going to go to our next question, which is from John Cross in Ward 8. John, your line is unmuted.
Hi, actually it's Ward 6, but that's okay. Dr. Shah, thank you very much. I appreciate it. My question is somewhat different because my husband and I have both had Moderna shots, and we're planning on traveling to Massachusetts in about 3 weeks. Massachusetts has required a COVID test certificate if you're going to be there, or they quarantine you. I'm wondering if you know whether states that used to do that will accept a vaccination card certificate in the place.
That's a great question, and unfortunately, I can't really opine or know definitively on what the Massachusetts state policy is going to be. I could tell you probably the experience that's occurring through all the states insofar as all of us have had some sort of test and quarantine type of policy for travel, and then the CDC really recommended for those who are vaccinated, those could be omitted as well. And then so in D.C. we adopted that. Other states may be on other timelines for when they adopt that. So unfortunately, I'm not sure when Massachusetts will. Our recommendation is to follow the state policy as well as the CDC guidance. Apologies, I can't be more helpful in your question, but I'm glad that both you and your husband are vaccinated.
Thank you, Dr. Shah. Again, if you have a question, you can press 0 now. We have time for just a few more questions. So we're gonna go next to Bob in Ward 3. Bob, your line is unmuted. Again, we're gonna go next to Bob in Ward 3. Your line is unmuted.
Residential health facilities, such as fitness facilities, such as social distancing, numbers using the facilities, or restrictions on residents only?
The question was, Bob, related to what changes for fitness centers in the district, I believe, which the mayor did announce some changes there beginning March 22nd. Again, for gyms, they are currently under a capacity limit and will continue to be of 25% or up to 250, whichever is less, as well as social distancing amongst equipment and patrons, mask requirements for indoor fitness, and then as part of the starting on March 22nd. Gyms will be able to resume, and gyms and fitness facilities will be able to resume indoor group fitness classes of up to 10 people per class, and as well as outdoor group fitness. The capacity for those classes will rise to 50 for outdoor group fitness classes. So those were announced by Mayor Bowser as beginning on March 22nd, and there will be updated guidance on the Phase 2 page of the coronavirus site for gyms and fitness studios. So the next question we are going to take is from Marjorie Rogers in Ward 8. Marjorie, your line is unmuted.
Hello, this is Marjorie Rogers, Ward 8. I was calling, trying to find out what is the wait time from you have to wait from taking the first shot to the second shot, and then also from the second shot, how long do you have to wait to travel outside of the you to another state or outside of the United States?
Thank you for the question. So there's 3 different vaccines, and they all have different timelines for dosing. So we're making it complicated. If you receive the Johnson & Johnson vaccine, that's 1 shot, then you're done. You don't need a second dose. If you take the Pfizer vaccine, which is available in some places in our portal, the hospitals mainly have it, and so does Kaiser, and One Medical at the ESA, that is 21 days. If you have Moderna, which is available in our federally qualified health centers and our pharmacies throughout the portal as well. That is 28 days is the difference. If you don't know your second dose appointment or you have a question about it, you can email vaccinate.dc.gov, and our team will help figure it out with you. After you receive your second dose, or you receive just the Johnson & Johnson single dose, give yourself about 2 weeks before you consider yourself fully vaccinated. And that means then you have the protections and any guidance that we give that says vaccinated people can do X and Y, then that means you're part of that group 2 weeks after your last dose.
Thank you, Dr. Shaw. We're going to go next to Patrice. Patrice, your line is unmuted.
Hi, thanks for taking my question. Hi, Dr. Shaw. I just wanted to know if there was an update or any record of the number of patients who have the variant to the virus, and also just wanted to know if we are learning how effective the current vaccine is against the variant, like, for example, the one from the UK.
Thank you for the great question. So for others listening, there's a few variations on the virus you probably heard, either called B117. A lot of people use those terms. Some people use kind of where they originated, whether it was in UK, South Africa, or Brazil. In general, some of these mutations make this virus move faster, and now we know some of them can actually make you a little sicker, and they might not be as, the vaccines may not be as effective as we thought they were. So that's the bad news. Another probably bad news is these some of these variants are likely going to be more and more common in the United States. There is good news, though, and also a majority of states, even in D.C., we've seen these variants. It's all about how fast we sequence them as well across the nation to understand how many of those are here. There's good news, though. The good news is if you wear a mask, if you social distance, if you make smart decisions about your activities, that protects you from these variants. Another piece of good news is the vaccines are still effective. We have been vaccinating a lot of folks here in D.C., but also across the nation, and in general, case rates have gone down. That means that the vaccine is doing its job, and we know one of the vaccines, the Johnson & Johnson, was actually studied in this environment where there was a lot of these variants around, and it had great results, namely 100% effective against death due to COVID-19 in the study. So even though there's some bad news, we have a lot of good things that we do know, specifically wear your mask, social distance, make smart decisions, and the vaccines are still effective and safe.
Thank you, Dr. Shaw. We have time for just one more question. We're going to go to ANC Commissioner Layla Bonnet. Commissioner Layla, your line is unmuted.
Hi, thanks so much. I think I know the answer, but just for the good of the order, saw a couple tweets today that regardless of eligibility, everyone is encouraged to go on the portal and pre-register for the vaccine so that they'll get notified when it is their turn, and just wanted to confirm that before I push it out to constituents. Thank you.
Yes, if anyone who pre-registers, they're going to be in our system, and then when it's their turn, we will be able to send out notifications. We do want to make sure, especially now, if you are eligible, then definitely make sure you pre-register so you could be in this queue of appointments we're getting out.
Thank you, Dr. Shaw. I want to thank everybody for joining us today. If we weren't able to get to your questions, our MOKers team is taking a list of all the questions that were still in the queue, and we will be following up with you to get your questions answered. So again, want to make the pitch for everyone that you can go now to pre-register online on the portal at vaccinate.dc.gov at any day, any time. And again, as Dr. Shaw just said, we really want to urge those that are currently eligible to please go and pre-register today. We want to thank you all for joining us for this week's call. Again, for the most up-to-date information and resources related to the district's COVID-19 response, you can go to coronavirus.dc.gov. I want to give a special thank you to Dr. Shaw for being our featured guest for today's call. And again, I want to thank you all so much for being here with us this evening. Thank you, and we'll talk to you soon.